introduced the COVID Alert app, which alerts subscribers to information that indicates whether they have been in contact with persons who are COVID positive. So it's an app that assists us with contact tracing in a case where a person you've been in contact with has tested positive for the virus. We are pleased that the measures we've put in place really place South Africa at the cutting edge of managing the spread of the virus. And we are communicating with all international airlines and other means of transport to encourage all international travelers who intend to visit South Africa to download the app on arrival so that they're able to monitor and minimize their risk of exposure to the COVID-19 virus. Travelers that intend to visit our country will be expected to produce a PCR test which is not older than 72 hours from the time of departure from the country of origin to South Africa. So let me repeat that. Travelers coming to South Africa will have to have done a PCR test. Scientifically, they say it's polymerase chain reaction test, not older than 72 hours from the time of departure from your country of origin to South Africa. The test must be conducted by a certified medical practitioner, and the certificate you produce at point of entry must have the name and signature of the practitioner who conducted the test. I think this must be communicated very, very clearly for every traveler to know that we expect them to arrive at point of entry with a certified PCR test. Upon arrival at a port of entry, travelers will be screened for any COVID-19 symptoms. So the fact that you have a certificate does not mean we won't take your temperature, does not mean we won't screen. We will continue to screen and also be screened for contact with people who've been infected with the COVID-19 virus. So you may very well be asked questions about contacts, etc. Travelers will also have to provide proof of accommodation addresses in case they need to self-isolate at the time of arrival in the country. So if they show symptoms and indicate that I have a booking in a hotel in Johannesburg, if that hotel or that accommodation is of a character that allows you to self-isolate, we would allow you to enter the country, but you've got to undergo the required quarantine period. Now, what we have done is agreed that not all travelers from high-risk countries will be permitted. We will categorize, as I said earlier, countries into 3 categories that Minister Motsoaledi will speak to in a moment. So you'll have the high-risk countries, those with high rates of infection and high rates of death. You'll have medium-risk countries, as I said, they're comparable to South Africa's rates. And then you'll have low-risk countries which are having very low rates of infection and some no deaths whatsoever. So we will have those 3 categories of countries. Travelers for leisure purposes from high-risk countries will not at present be permitted into South Africa. Only persons who are high skills visa holders, who are investors in the economy of South Africa, will be allowed entry if they are from a high-risk country, or diplomats, as is currently the regulatory position, right? So the regulations with respect to persons traveling from high-risk countries remain in place. So leisure travel not permitted. Leisure travelers will be permitted from medium risk and low risk countries. We will also allow travel for travelers from the African continent, both for business and leisure purposes. But everybody will be required to be screened, and they should have a test. And if you don't come with a test, or your test is old and we test you here in South Africa and you're found to be positive, you will have to undergo 10-day mandatory quarantine at a facility identified by the state, but at your own cost, because you knew prior to departure that you had to come with a negative test if you wished to be admitted. All right? So those are the key elements. Minister Kubai Ngubani, have I left anything out? I think I've covered the salient points, and any matters that are not clear, we are able to provide you with responses. But South Africa is now opening up. Let me indicate that in terms of land borders, we will retain the borders that are currently open as open. And the ones that we closed at the inception of the COVID-19 restrictions, there are about 35 borders, land borders that were closed, those will remain closed, all right? So not all land borders will be open, just those that are currently open. Those that are still land borders and closed will remain closed. The main reason being, we do not have the supervisory health screening capacity to staff all those land borders. All right? Thank you very much, Minister Mtembu, and thank you, colleagues.
Thank you very much, Minister Pando. What we will do now, ordinarily I would have asked my colleagues to say a word or two, but because of time constraints, we will then take questions. As they come here, they can then expand on the matters that they will also like to speak to you about.
Sorry, Minister, I should have added that only 3 airports will be open for international air travel. Those airports are OR Tambo International Airport, Cape Town International, and King Shaka International. Right? So all airlines arriving must be at those 3.
Maybe before we do so, because we have said that there are countries that are high-risk countries, I think it's only fair that we level up with you as it relates to those. I'll then ask Minister Mtswaledi to come and speak to us. What are those countries that Minister Pando has spoken to that we regard as high-risk countries where there will be no allowance of leisure visitors at this point in time? Minister Mtswaledi.
Thank you very much, Minister Mtembu. Thank you, colleagues. Before I come to the issue of high-risk countries, there are certain things which will also affect the issue of travel or opening of borders in terms of visas, which of course Minister Pando did not necessarily appear on his statement. So I want to mention that the Department of Home Affairs is extending the validity period of legally issued visas, which expired during the lockdown period to 31st of January 2021. You may remember that when the lockdown started, we announced that all the people who are on visas which will expire intra-lockdown, we extended them to the 31st of July. Then when the 31st of July approached, we extended them to the 31st of October. Now, today is the 30th of September, and it's clear that by the 31st of October, things will not have changed. So we are announcing today that all those will be regarded as valid until the 31st of January next year, 2021. So anybody who's having a visa that expired have got nothing to fear. This means that visas, I'm talking about people, by the way, who are inside South Africa on visas already. This means that visas lawfully issued and expired during the period of the lockdown remain valid until then on the 31st of January, as I said. Holders of such visas are permitted to remain in the country under the conditions of their visit until then. Those wishing to be repatriated to their countries within this period can depart without being declared undesirable. I think I need to explain this. Usually when you are on a visa that expires while you are inside the country, if you go to any port of entry and produce that expired visa, they will allow you to go, but your passport will be stamped undesirable because you have exceeded your period. So we want to assure such people that if you arrive with a visa that has expired, because we deem it to be valid until the 31st of January, you won't be declared undesirable. So people have got nothing to fear. The department is also resuming services for applications of identity cards or documents for all types of passports. You may remember that we're not issuing identity cards and we're issuing passports only to a select group of people. So we want to inform the nation that people can now come to apply for their IDs and to apply for their passports. We are no longer categorizing people who must get passports. Visa services, including submission of application through the VFS, the Visa Facilitation Services Global, will also resume on the following categories of visas: Visitors Visa, Study Visa, Treaty Visa, Business Visa, Crew Visa, Medical Treatment Visa, Relatives Visa, or all these type of visas. Waiver of prescribed requirements as contemplated in Section 31(2)(c) and appeals to review contemplation in Section 18 of the Section 8 of the Immigration Act. Some of these services will also be available through our missions abroad. I did not read all type of visas. If you think there's any type of visa that confuse you, I'll answer it during question time. As Minister said about the countries that are coming from high infection and the conditions under which those countries will be expected to visit our country. I was just trying to get it on my document. Oh yes, it's ready here. Yes, the high-risk countries, we have got Puerto Rico, Qatar, Romania, Russia, San Marino, St. Martin, Slovakia, Slovenia, Suriname, Switzerland, Trinidad and Tobago, Turks and Caicos Islands, Ukraine, United Kingdom, United States of America, United States Virgin Islands, and Venezuela.
There are no African countries. No, there's Tunisia. Oh, there was Ghana. Let's leave it. We said.
No, it's okay. It's not every day that we discuss such weighty matters. Minister Pano?
It's a very complex matter to make decisions on. So one of the things I did not mention is if you arrive, as I said, and you do not have a test, the PCR test, certified, we will screen you, and if you show symptoms that are related to COVID-19, you will have to undergo a test here in South Africa. And we are requiring, because the tests cost money, that every person traveling into South Africa must have travel insurance in order to cover the cost of the test, and should the test be positive, the cost of quarantine. So mandatory travel insurance for those reasons, so that South Africa doesn't find itself overburdened with test costs because travelers did not act on our provision that you must have a PCR test.
Thank you very much, Minister. We will now take your questions, colleagues. I know that there are those who will be calling in, and there are those who will WhatsApp. Maybe let's first check whether there are any in-callers as we speak now.
Thank you, Minister. We don't have callers at the moment.
Thank you very much. Colleagues that are watching our WhatsApp machine.
Thank you, Minister. I have a few questions. Anthony and IFP. For travelers from high-risk countries, exceptions will be made for business travelers, as in work permit holders. And what about their families? And have Genevieve Quinto from Business Day. Will South Africans who are in high-risk countries be allowed to enter the country? Also, will South Africans be allowed to travel to high-risk countries, especially those who have families overseas? And then I have Vinicius from Brazil. He's asking, what are the restrictions for Brazil flights? And I have Angelo Coppola from CGTN. Will business and leisure travelers from Africa also have to produce a 72-hour-old PCR test or on arrival at borders? And I have Miriam from Telegraph. What are the procedures for residents, non-SA nationals with valid residency permits who have been locked out of South Africa during lockdown and want to come back? Those are a few questions for now, Minister.
Thank you very much. I think there are some questions that speak to repatriations, which we have been doing as a normal thing under these abnormal circumstances. So if there are South Africans who are anywhere in the world who want to come back home, I can assure you that they'll be allowed back home. Similarly, under our repatriation measures, if there are any nationals of other countries who are here who would like to go back to their countries, we have allowed that already. And we work with the embassies, yes.
Diplomatic law.
So that has happened already. So
International law.
yes. I don't know whether you want to add anything, colleagues, on the other questions that have been raised. Minister Mtsoledi?
No.
You can use that. You can use. It's audible enough. All the mics are audible, yes.
Don't touch. Just talk. Yeah, can you hear me? Yeah. No, Minister, I am very sorry because of technology. When I read the countries that are high-risk countries, I only read the what you call the screen here only showed me the last column, and these are countries I read in the last column. There's still a first and a second column which I left out. I just want to go on with it. I started with the last column, which started with Puerto Rico, Qatar, and unfortunately, the last columns I could not see them, and I've seen them. It's the Dominican Republic, Ecuador, Faroe Islands, France, French Polynesia, Georgia, Gibraltar, Greece, Guam, Guatemala, Guyana, and the Honduras, Hungary, Iceland, India, Iran, Iraq, Ireland, Israel, Jamaica, Jordan, Kosovo, Kuwait, Lebanon, Luxembourg, Maldives, Malta, Mexico, Moldova, Monaco, Montenegro, Netherlands, Nepal, North Macedonia, Oman, Palestine, Panama, Paraguay, Peru, and Portugal. Thank you. That is the complete list now.
Thank you very much. As we read these lists of high-risk countries, we have already said there are categories that are allowed to come into this country from those high-risk countries.
Yes.
Minister Pando has spoken to those categories. It doesn't mean that everybody from that country, including investors, for instance, including people who are business people, including people who are sporting and cultural activists, even from those high-risk countries, those people are allowed into our country.
It's just leisure travelers. It's just leisure travelers.
Yeah. It's just leisure travelers. It's just those who are coming here for leisure. That for now, again, let's say for now, they are not allowed. It doesn't mean that they will not be allowed forever, because indeed even the high-risk characterization of their country might change to low risk or medium risk.
Every 2 weeks.
We will review the data every 2 weeks, because data is released by countries every 7 days, mostly. Many collect daily and they collate weekly. So we agreed that if we give ourselves a 2-week period, it allows us then to have a basis of epidemiological data that allows us to reach conclusions that we feel are safe for the country.
Yeah.
Thank you, Dr. Mtswaledi. Any colleagues who want to then answer the questions that have been asked by our listeners?
Well, I think Minister Mthembu answered the one about South Africans in high-risk countries. South Africans are allowed to come back, but of course, if you have symptoms, we will screen, as we've said.
Yeah.
And we would place you either in self-isolation, as you know the regulations allow that, and if you are not in a position to self-isolate, then you would have to go into a state-identified facility and isolate there. The Brazil or any other country's flights are under the decision of my colleague, Minister Mbalula, and he would be the one who would grant approvals for various airlines. Given that we've said that travelers from Brazil would be regarded, leisure travelers, as high risk, we would not expect that there would be commercial travelers from that country. But we've had repatriations from Brazil, as well as their citizens being repatriated from South Africa on agreement and permission granted through Minister Mbalula's office. On valid permits, well, we've explained, as has Minister, I think, Motsoaledi, that if you have a valid immigration document, and you work in South Africa, for example, persons with relevant work permits will be allowed into the country. School children, again with the necessary permits, who attend school in our border towns in South Africa, will be permitted to enter and exit, as will be teachers who teach in those schools in the border towns. So that will be allowed, but of course the necessary screening will be done.
Any other colleague who want to expand? None. Sorry.
Yeah, yes, I just want to emphasize that we must remember that Minister Dlamini Zuma, on the 17th, of this month was on this platform issuing out the regulations. So this what we are doing is supplementary. Some of the issues are on those regulations. For instance, on this issue of daily commuters from the neighboring countries, teachers, learners, is on the regulations issued by Minister Dlamini Zuma on the 17th. It's Regulation 75 on partial opening of borders. All those outlined, so we just chose those we needed to explain today. Thank you very much.
Your first question was about families. That was already addressed in the regulations, the new ones that Minister Dlamini Zuma announced. And in fact, we'd already had an embassy to international relations process related to that. Because you can't allow in a business person who works here and prevent their family from joining them. Nor could we do that with many South Africans who work in Dubai, for example, and were in South Africa at leisure when the lockdown was initiated. We had to then allow for them to be repatriated to join their family.
Thank you very much, colleagues. Can we take another round of questions? If there are callers that are able to call in now, do we have any?
Still no callers on the line, Minister. Thank you.
Let's continue with our WhatsApp.
Thank you, Minister. We do have questions on the WhatsApp line, starting with Christian Duplessis from Network 24. He's asked if will people for overseas who test positive be sent to quarantine facilities identified by the state, and do they have to pay out their own pocket? His next question is
maybe if he's listening, I hope that he was listening to Minister Pando's statement.
Understand. Yeah.
Okay.
His second question is the WHO guidelines about the international travel, the minister available to the public, and where can it be found? And his last question is, to which countries can South Africans travel to? We also have another question from Mawande from Sunday Times. He's asked, which category will travelers from countries such as Tanzania, which never took COVID-19 seriously, fall under? Secondly, how will we handle diplomatic fallout that may arise from countries feeling hard done by being placed under the hard risk and want to retaliate through other means? We also have another question from Llewellyn Prince of Network 24. When South African citizens travel overseas for business or leisure, will they also have to get tested in the country that they visit before they return? And must they also bring back a certificate to prove that they tested negative for COVID-19 there? And if positive, will they be able to return back to South Africa and their place of residence in any province to isolate or quarantine there? There's another question from Gay Davids of Eyewitness News. He's asked, what review mechanism is in place to lift restrictions on travel from high-risk countries as their rate of infection and death improve?
Okay. You have now given us about 6 questions. Let's take them. Maybe let me start with you, Babu Pal.
Public health. It was published on 30th of July.
Well, the directives we are following are indeed available. WHO, as colleagues would be aware, on a regular basis issues advisories to member countries. And this one on international travel was released on the 30th of July 2020. So if colleagues would go to the World Health Organization website, look on the announcements and advisories of the 30th of July 2020, they will be able to find these guidelines which we are using. Thank you.
Any other colleague who wants to, Mr. Soderi?
Yeah. there was a question about Tanzania, and because they never took COVID-19 seriously. All African countries are allowed, subject to the conditions which Minister Pando has said. We are not going to stop anybody from any African countries coming here, whether they are leisure travelers or what, but the conditions will definitely apply in terms of the test and the quarantine and all that. The issue of diplomatic call-outs from high-risk countries, I think Minister Pando said it clearly, that from the high-risk countries we are stopping only leisure travelers. Diplomats, business people, investors, people who are coming for sports, arts and culture, researchers, all of them, even from the high-risk countries, we are not going to stop them, but also subject to the provisions of what Minister Pando has already mentioned about what they must produce, etc. The other thing maybe which is important worth mentioning on the regulations from the Department of Home Affairs is that when such people come to the country, we are going to ask them, and maybe I must, they must apply an application referred to must be made to email COVID-19 business travel at Department of Home Affairs.gov.za, and it must be supported by a copy of passport or temporary residence visa, proof of business activity to be undertaken in the Republic. That means proof of what they are coming here to do, proof of travel itinerary, which countries have they touched, etc., and proof of address or accommodation in the Republic. We must know where they will be in the Republic. Those are the only things we want from people from high-risk countries who will be coming here, who we have already categorized. Will South Africans be allowed to travel to any country? If those countries allow them to, then there's nothing that stops them. But when they come back, they'll be regarded as people from the high-risk country. And so we'll have
if they went to a high-risk country.
Yeah, if they went to a high-risk country, yes, I'm talking about high-risk. Otherwise, any other country they can visit. I'm talking about high-risk. They'll be regarded from coming from a high-risk country in the same way that a citizen from a high-risk country who had spent more than 10 days or more in a low-risk country, when we process them, we'll be regarding them to be coming from a low-risk country, even if they hold a passport for that high-risk country, right?
A person who tests positive shouldn't seek to travel because you are endangering other persons.
Yes.
And so the country from which you're departing has a responsibility to either place you in a health facility or in a quarantine facility, or to require you to be in self-isolation. A person who has a positive test can't board an aeroplane, should not be allowed to do so. And remember that high-risk countries themselves have their own regulations as well, some including lockdowns totally.
Minister Kubai.
No, I just wanted to emphasize, Gay Davis asked the question about the review mechanism, and in the statement it does indicate that there will be review fortnightly in terms of the criteria as per set, whether a country could be high risk now, it can become low risk. It can be low risk now, it can become high risk. So it's something that NCCC and Cabinet will consistently evaluate and announce. So the list that is issued, I think, for the travelers, especially the leisure ones, is to say it's not something that they should keep on looking. So we shouldn't be asked to say provide this. Government will announce it formally to say these are the list per fortnight. I think that's why she's asking. Thanks.
Thank you very much. Mr. Mbalola, I wanted to say something?
No.
Okay. I hope we have answered all the questions. We will take the last round of questions. We can hear now, first one.
Thank you, Mr. On WhatsApp, I have Shaw from Japan's national broadcaster. If I leave South Africa to cover news in a high-risk country, can I return to South Africa? Will you allow the re-entry of an international journalist like me? And her second question is the timing of 72 hours? I think the minister has answered this one. I have Ndumiso Mlilo. Could I get clarity on where China fits? Medium or low risk, and why? I have Susan from AFP. When will South African embassies abroad reopen and resume processing visa and permits applications? And I have Patrick from Fleet Watch magazine, is directed to Minister Mbalula. Cross-border agents have received a notification from SARS detailing a directive from the National Border Management Coordinating Committee regarding opening of ports of entry for movement of persons and goods. It states that as from 1st of October, that's tomorrow, all truck drivers leaving and entering South Africa will have to present a COVID-19 negative result on departure from and arrival at the South African borders. Is this true? If so, the drivers will not be able to adhere to this. Komati Port, for example, has some 2,000 drivers crossing per day, and where do they get these tests done by tomorrow? And what of the drivers who are currently out of the country returning to South Africa? They do not have where to have tests done to comply with these on their return. The practicalities of implementing this from tomorrow provide a logistical impossibilities. Can the date be postponed, or is this set in gold? Thanks, Minister.
So that was your last one.
Okay, I have another one. Sorry, Minister. From Sofa Mukwena from SABC. The Northern Hemisphere is now approaching winter, and numbers are going up. With South Africa now approaching summer, what are going to do to ensure that we don't experience a surge on important cases as tourists will be visiting the country to enjoy the sun? And I have another one, Minister, from Christian Du Plessis.
I hope that's the last one, because
that's the last one, Minister.
Okay.
All medium and low risk countries allowed to travel to South Africa for all purposes? That's a question. Thanks, Minister.
Thank you very much. Who wants to start?
Let me just start with the last one.
Yes.
All travelers, including leisure, from low and medium risk are allowed to South Africa, including all countries on the continent. Thank you.
Joe, want to take something?
Journalist, yes.
Well, I think the immediate one I can take. Let me just, or should I leave the I think the China is quite clear that, I mean, they had high infections quite early, and they managed to contain and very successfully. So if we can also just remember that even at the height of our imported infections, there were very, very few, if any, arising from China. Our imported cases came from Europe mainly and the US. So at the current moment, China remains a low risk because of the declining numbers. As colleagues will be aware that even cities like Wuhan, which remained under restrictions, are currently under completely no restrictions. So that explains why, from the question which asked about China and with category of risk, it is definitely low risk. Thank you.
Let's start with
summer issue. Clearly, I think the categorization which is there, as the ministers have explained, that the monitoring is ongoing. So indeed, as the infection rates change on a daily basis, our team, both from health and net joints, will be monitoring as they've been doing on a daily basis. We have a World WHO barometer which gives us the figures on a daily basis. So those will be aggregated on a weekly basis and on a fortnight basis and presented to Cabinet so that the categorization can be reviewed. And those who, as a result of change of weather, if indeed, remembering that it's not yet, scientifically confirmed that weather is indeed a major factor, but let's assume that it is. If those numbers start rising, even those countries which currently are on medium and low risk, they will then be categorized and excluded from leisure traveling. So that will be, and the announcements will be made regularly. Thanks.
Yes. Okay. Yes.
It's important for us to repeat what President Ramaphosa has said, that the fact that we've entered level 1 doesn't mean the risk has ended. And so all the measures to protect ourselves must continue to be practiced. We should be wearing our masks when we're out in public. We must sanitize. We should ensure we wash our hands properly. We should ensure we avoid large gatherings and keep to the regulations. Not more than 100 people at a funeral, and all the rules that have been announced by government to protect us. To avoid an increase in numbers, we must observe all the guidelines of safety measures.
Mr. Mbalulu?
Yeah. Cross-border transport passenger services are permitted to operate from the 1st of October 2020. Cross-border freight transport and logistics, which is the question that has been asked, in respect of specified cargo and permitted retail goods to neighboring countries, which include goods imported through the South African ports of entry for re-export to neighboring countries, is permitted. All owners of cross-border road transport facilities must, on regular intervals, do what is right, sanitize and do all of that. The following measures will apply to all vehicles undertaking cross-border road transport services. Vehicles must be sanitized before picking up. All public transport vehicles, doors and window handles, armrests, and all of those things are supposed to be sanitized. Passengers must sanitize also. Operators must ensure that all cross-border road transport vehicles are clean and tidy. And operators must provide disinfection. All drivers must wear masks and all measures. No persons will be allowed to use any form of cross-border road transport or enter a building, place or a premises if they do not wear a face mask. So all cross-border operators from the first, like we said, will be allowed to operate, and so in terms of land transport and so on, so that is permitted in terms of also the directions that will issue will further elaborate on that. Minister of Home Affairs.
Yeah, I had a question or a statement that we must postpone the date because the logistics won't allow. And the person who asked the question quoted Komati Port. That's Lebombo border post between us and Mozambique. And he quoted truck drivers, etc. Remember that people who are conveying cargo, freight and cargo, have never been stopped even during lock level 5 when we started. The 18 border posts that have been operating, it was them operating there, and they were operating under particular conditions. They will just continue under those. What we are aiding are ordinary other travelers other than the truck driver. The truck ones have been doing it, they've never stopped. taking essential goods and cargo across the border. There's a question about the journalists who visit a high-risk country, whether will be allowed back in South Africa. A journalist who visits a high-risk country will be considered like any other person from a high-risk country. We won't stop them, but we'll regard him as a person who is doing their job from a high-risk country. They will have to follow all the protocols that people from high-risk countries follow, which have already been mentioned several times this afternoon.
There was a question, I don't know whether it will be you who will answer it, about opening of embassies, visas, etc.
That happened. I saw the DG wrote to our DGs long ago, so that's already in motion because we were preparing for October 1. I think it was sent about 22nd of September, if I'm not wrong.
I've also read it in my statement about embassies and visas and VFS. Visa facilitation facilities, they are open. Yeah.
Thank you. Thank you very much. Colleagues, to yourselves and to the listeners at home, thank you very much for giving us your ear. Oh, well. Okay. In that event, because no, don't worry, we will do what is right. Normally, we just get these calls because there are no journalists here. We thought that we had wonderful visitors who wanted to see our faces. Of course, we will take your questions, colleagues. My apologies. But we are here to serve. How many of you are here to ask questions? 1, 2. So it's 2. That's good. All right, let's start, Bob.
Hi there. My name is Malunga Lupwe from Newsroom Africa. It's a clarity-seeking question. The Minister, Naledi Pandor, said that everyone who is traveling to South Africa will have to have a travel insurance. What happens if somebody comes here without one? Thank you.
Okay. Sir. Colleagues, hold your horses. Yes, sir.
The question is directed to Minister of Transport. First of all, thank you for the opportunity. With the announcement of the opening of the borders for international visitors in mind, the Private Charter Passenger Association, who represent charter and tourism bus operators, has been trying to engage with the department for the past 7 months to discuss measures to assist in the survival of these operators that rely on tourism. These operators have not been able to operate since the start of lockdown and are in severe distress and have not received any support from the department. The chairperson of PCPA were granted a meeting within the last 2 weeks with the Director General, Mr. Alec Mooney, to discuss the problems faced by these operators, but haven't received any feedback. I would like to ask if the Minister can clarify if the department will be able to assist the members and operators from the PCPA in their fight for survival, and if the charter and tourism sectors is going to be assisted with the licensing fees of those vehicles that they outplayed during this lockdown period. Thank you.
We can now answer.
You must have travel insurance. Normally, it would be purchased once travel agents are aware when you buy your ticket, the price is included, or you can purchase it separately. But when you say it's mandatory, it's required. You shouldn't be allowed to board because then it becomes the problem of the airline when we don't allow you entry.
Mr. Pai.
Thank you very much. I think that just to supplement, normally once a communication goes like that, the airlines then puts mechanisms to say if you are traveling, these are the requirements at boarding. So that's what is expected to say as part of traveling, to make sure that people would have a 72-hour at the time of boarding certificate and all those that are required for flights. It makes it easier. It becomes part of the requirements. Mainly, I'll talk because the issues that has been raised about charter flights, they affect tourism. What we have also agreed to is that all the activities in tourism, because the support services that we had, or the relief fund that we had for tourism subsectors, whether it's your tour operators in terms of cars, vehicles, and all that, what we have agreed is that we have only had limited funding available. And that's why government worked around the clock to ensure that tourism activities come back to life, because we knew that we would not have enough funds to support everybody. So our hope is that as we get more activities for tourism, everybody will be able to start gaining back in being able to get tourists and be able to find a way of saving their livelihoods. In terms of the issues around permits, we've been working around in partnership, yes, with transport. The issues around permits for tour operators, the cars, that work we've been doing together with the TBCSA. There's been meetings with the Director General of Transport, with us coordinating. But also what we have done, because Minister Mbalula is here, the issue around the regulator was a bit of a challenge. So we made an intervention when we went to intervene and requesting him to assist us. Another time we are required that the permits at least can be segregated to provinces. And the feedback came to say, no, it will not work. If I have a company that operates interprovincially, it's going to be a challenge. And that was also resolved. A new regulator, Minister Mbalula, has appointed. We do have representatives that is allowed from the department to sit in that regulator, who are looking after the interest of the tourist operators who are constantly affected. So we're expecting that as we come to life, a lot of things will be resolved, those were not resolved previously. We do have 2 officials from the department that are sitting in the regulator to look and ensuring that the backlog is cleared and the issues are resolved.
Mr. Mbalo.
Consulting. Can I go on?
Go on.
Yeah, Malungelo. Yes, maybe to help him more. It does not necessarily follow that people who get into a plane and come to this country, they just surprise us. There is a team in Home Affairs which works for 24 hours. Any flight that depart any part of the world, they communicate with us and send us a passenger list. Anybody we don't want, we tell them. If you have been in a plane before, you may remember that just before they close the door, there are people who rush in, having a list there, which they give to the pilots. That list is going to be sent to the team here, that we've got this list of people coming from to your country. If we don't want any one of them there, or we suspect something or it's a problem, we tell them that no, this one can't come. So when they come, we already know. And as Minister Gubani has said, the airlines are given a list of requirements for any country. They don't just take people to any country. They find first what the country wants. Some countries might be wanting a yellow fever certificate, and they'll tell you in the plane that no, you don't have, you can't go. If they bring somebody who doesn't have the requirements, then the airline must take them back at their own cost. In fact, we even charge them a fee. I think, I forgot, if I'm not mistaken, whether it's there's an amount which we charge per passenger if any airline breaches all those protocols. So it's not something that happens at random. It's a very highly controlled system. Even before COVID-19, by the way. I'm not talking about COVID-19, I'm just talking about how people move from one country to the other using airlines. So all those things are highly controlled. It's not that they happen per chance. If an airline allows somebody to come here who doesn't have that 72-hour certificate, if they arrive here and we doubt their status, it's the airline that must take responsibility together with that individual, not us, because the airline will have known about that requirement. Thank you.
Mr. Baron.
Thank you, Minister. First, we need to clarify that in terms of COVID-19, there are many companies and small, medium, macro enterprises that have been in distress. And part of the 500 billion the President talked about included a credit guarantee COVID-19 loan scheme. Now, individuals and different companies, and of which these companies also fall in that category, have found that the measures that are required by the scheme are too cumbersome for them, SARS and all of that, and many people have not accessed the money. So the 500 billion part of it included that. We only had a special dispensation for the taxi industry because they are not formalized, all right? They are not formalized, they are not fully regulated, and that is why we had a 1 billion rand taxi in our issue, which we are still discussing even now, in terms of it being a special dispensation on ex gratia basis, okay? It's something that you give, but you are not obligated. You do it simply because people are in distress. But, you know, you've got to help because of COVID-19. That's what government has done. So there is money and people don't access that money. They've got companies, but some of them, probably their companies are not properly registered and all of that. So what do we do as the Department of Transport? Mr. Muyemi and the department are the right people to contact. Even ourselves, the lady sitting next to you, there is Ayanda Ali Payne, our spokesperson. We will be happy to work with those companies to help them to access the funding because we understand that they are in distress and understand what are their challenges and so on. Besides that, Minister Mamulu Goye was also having her own support to tourist companies, and I think it was about 200 million. And so those companies that were supposed to access that funding through tourism have accessed that particular money. So in this particular instance, we'll be happy to help, to assist those companies that are in distress to understand the challenges that they are faced with. My last point is that any airline before it departs, like we have declared the 1st of October, we have now announced today through Home Affairs and DIRCO and ourselves, our part is with regard to transport, air travel. So all the countries that are permitted to come to our country, their own airlines will be issued with what is called a NOTAM, and which will be a notice to basically fly so that their own citizens can come to South Africa, with the exception being those who are not permitted to come. So that's what is important for us, and that's where we come in. We permit people to come in with their aircraft and all of that, to land, to do everything in South Africa, right? To come and even departure, so from wherever they come from. Minister was telling me here that the Germans are coming tomorrow. But, you know, they must have all these details, 72 hours and all of that. We can receive them at the airport is good, is tourism, is fine. And that is what is important between the two countries. But over and above that, preparations at an operational level are being undertaken by AXA, by ATNS, working with the airlines, and all our teams are ready for that. So should there be any misunderstanding or information required, we are able to give you information in that regard. But airlines, you don't have to worry, because wherever they are, they know the status. Even though now it is more complicated before level 5, because at level 5 it was World Health Organization that make a determination that these are low-risk countries, high-risk countries, and that is it. At the present moment, yes, there is a totally different picture altogether. And we, on our own, were able to make such determination. So NCCC have pronounced on that. Minister Mtswaledi spoke on that. And I think that list will be important so that you also have it as media to help us, so that people can understand which are the countries that are permitted to come. In case those who want to go and work outside and they want to go for leisure and all of that from South Africa, you also need to get that information and to know that information. And so Home Affairs is leading us in that regard, and this is what the minister was explaining. Thank you, Minister Mtembu. No, the problem you're coughing next to me.
Colleagues, as we have said, we will continue having these briefings from time to time. Don't worry about Mbalula. We will continue having these briefings from time to time, because it's important that all our people, wherever they are, they must know what happens on the 1st of October. And that was the intention. Can they fly? Are they allowed to fly? Even our tourists, they should have a sense of what is to be expected as they land in the country. And again, my colleagues have explained to you how we have categorized high-risk countries and low and medium-risk countries. With that said, again, our colleagues have said even those categorization of countries will also be looked at from time to time, almost on a fortnightly basis, to see whether they are still high risk or they have moved to low risk or medium risk. Similarly, those that are low risk and medium risk will also be assessed on a fortnightly basis, whether they are still where they were in the past 2 weeks. Colleagues, again, thank you to yourselves for attending this media briefing, and to the people at home, thank you very much for opening your houses to listen to what the National Corona Command Council has to say, and also to listen to the decisions that Cabinet has taken as it relates to easing restrictions as it regards international travel. For that, we are very thankful. With that said, this meeting is adjourned. Thank you very much.
Don't leave the chair.
I want the list to be checked. No, definitely. Are you aware what it actually is longer than that? No, actually.
No. I want the number of the ambassador, because even the things you are asking to remove, they don't know.
Yes.
I don't think that list is actually.
I want to.
The PSA in fact to just say some guides.
No, I want to minister so that I release it publicly, because fortunately we do release it.
It's already on. It's in the news already.
I only given you this one.
Give me this one.
That copy did not include this one. Albania and Malawi.
You gave me this.
And then you read this too.
I read this too. I didn't see this.
This one.